Good day. I'm Dr.K. Gireesh, physician, neurophysician, and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, we am organizing a CME program, continuing medical education program. It's a health awareness program for the public. The topic is facets on epilepsy. And this is part two. We are talking on one type of epilepsy, which is reflex epilepsy. Now, what is a reflex epilepsy? They are epileptic events which are precipitated or triggered by external events or internal mental process. This was described by Marshall Hall in 1950. So that in fact is reflex epilepsy. Now, let us see what are the types of external stimuli that can produce the fits. Hot water epilepsy is one. Photosensitive epilepsy is another. Reading epilepsy is another. Musicogenic epilepsy is another one. Eating epilepsy. Now, these are various forms of reflex epilepsy. Now, let us briefly see what the features of one or two of these. Hot water epilepsy, it is more seen in the southern India, and there are cases reported in Japan, Turkey, rare cases, and some are very, very rare in Europe. Now, what happens is when you pour hot water on the head, suddenly the patient goes in for a seizure. This is it can also be called as a hot water head, the hot water epilepsy, or even a bathing epilepsy, it is called. So, hot water head bath, the symptoms are seen in about 80% of patients. Sometimes a hot water body bath can also produce this. In about 19% of patients, it has been reported. It can even occur sometimes even with cold water. The temperature usually of the warm water that produces the seizure is around 45 to 50 degrees centigrade. Now, what happens is a massive tactile stimulation, which an aberrant thermal regulation produces the seizure. And one can give anticonvulsant therapy. But here again, the treatment will be, intermittent oral prophylaxis can be given. An oral clobazam, which is a short-acting benzodiazepine anticonvulsant, can be given about 1 to 2 hours before the head bath. And then the person can have the head bath. That, in fact, is hot water epilepsy. A hot water head bath can produce symptoms in around 80% of patients. Hot water body bath can produce in 19% of the patients. Can even sometimes that can occur with cold water bath too. The temperature is around 45 to 50 degrees. A massive tactile stimulation or an aberrant thermal regulation. These are the things that precipitate or provoke a seizure. And anticonvulsant therapy is advocated for this. Intermittent oral prophylaxis, oral clobazam at 1 or 2 hours before the head bath is ideal. The other reflex epilepsy is reading. After reading for some time, the jaws start to click and there might be a twitching or myoclonus of the face, and then it can lead to a tonic-clonic seizure. It can be triggered by other language functions, example, writing or speaking, or even may have a family history. Now, EEG shows 3 to 6 hertz discharges in the temporoparietal region. Spike and wave discharges are seen. It may be a variant of the juvenile myoclonic epilepsy. That's called the reading-induced epilepsy. The other is sometimes when there is increased mental concentration in card games or solving a chess, sometimes can trigger a seizures in whom they are actually prone to. And EEG shows a generalized spike and wave pattern for this. The other is eating. It has been reported, some reports have come from Sri Lanka too, that this is a trigger usually soon after the eating. But sometimes it may be the sight of the food or swallowing or an abdominal distension. Usually a partial seizure is what that have been described. So these are some of the forms of reflex epilepsy. So we saw the hot water epilepsy, then the music epilepsy, reading epilepsy, eating epilepsy. And photosensitive, I'll be telling in another part. So that's in brief on reflex epilepsy part 2. which comes under the banner of facets of epilepsy. Thank you. Thank you very much.